There's another new variant of the COVID-19 virus. It's been identified, this time in Brazil, and here to discuss what that could mean for vaccines is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Doctor, thank you so much always for joining us. You've told us we should expect this virus, unfortunately, to mutate. So far, we've seen these new variants in the UK, South Africa, now in Latin America. How concerned are you about the ways this virus is changing, and are we going to need new vaccines based on that information?
Right. So, Maria, of course, most mutations don't change the virus, so they're not concerning. But these mutations are a little bit more concerning. The one from Brazil looks more like the South African variant than the UK variant. There's a few more of those key mutations in the spike protein. What some of these mutations do is it changes the shape and the charge of the virus. So it can actually take its spike and attach into the receptors in the back of the nose and really embed itself. So maybe that's the reason why it's more contagious. What we really have to do, number one, is we have to flatten the curve, because as the virus spirals out of control, you can expect more variants to come. The other thing is, remember, we cannot, it's important to measure and monitor these viruses. So we have to do more genetic sequencing so we know what's actually the dominant strain.
Do we have any idea, if at all, the vaccines will handle it? I mean, it's too early? Is that what?
So far, preliminary evidence shows that the vaccines are effective against some of these mutations, but it's not like all of these mutations have been tested. So we're going to have to see over time how well the vaccines work. We think that they will work because the vaccines induce immunity against a lot of different parts of the virus, not just the spike protein. So hopefully it will. We don't know if it will be that 95% effective. We'll have to see over time.
So, Dr. Ellerin, we're learning as we go along. This preliminary study out now suggesting that COVID patients have only 5 months of immunity after infection. So my question is, only 5 months, or is that good? I don't know the answer to that. So
this was a study from the UK that looked at about 20,000 healthcare workers. About 6,000 of them had had natural infection, and they were looking to see, what's the risk of reinfection. The good news is that getting infected there was about an 83% reduction in getting reinfected. So it wasn't 100%, but it was still very good. So natural infection does decrease the risk of reinfection. But one interesting point about this study was that they did see that patients who had been infected in the past could actually harbor virus in their nose at fairly high levels. So when you hear about the fact that you may get the vaccine or you may get infected but still be able to transmit to a susceptible person, this study sort of bore that out.
Yeah.
Interesting. The federal government urging COVID patients to request monoclonal antibody treatment, saying that doctors are not prescribing them enough. Do you agree with that? And are these antibody treatments, are they keeping people out of the hospital?
Yes, I think that is true. One of the issues is right now is that we're really focused on rolling out the vaccine, okay? But there are certain places in Massachusetts that are giving monoclonal antibodies. But one of the issues is these monoclonal antibodies have been shown to work in patients before they reach the hospital, and often it's before they have severe symptoms. So it's often when they feel well but are at high risk, so you have to choose the right person. By the time the patient gets in the hospital and is on oxygen, it's too late to give. So we have to figure out ways to roll this out where we can find the right patients who are high risk but still early in their course.
Doctor, I know we're out of time, but I do want to squeeze one more in here. Have we learned anything about the way the patients can manage mild or even moderate COVID symptoms at home?
Right. So again, back to the monoclonal antibodies. If they're high risk, that's one of the therapies. But for most people right now, we're really managing them supportively. If they find themselves that it's easier for them to breathe on their side or when they're prone, it may be better than when they're lying on their back. That sort of raises the oxygen levels. Hydration, fluids, rest, it's sort of the common things. If you have fevers, you can take nonsteroidals or Tylenol. I mean, I know that doesn't sound great. The truth is we don't have great therapies yet, like the Tamiflu for influenza. We don't have that medication yet for COVID-19.
Dr. Ellerin, it's great to see you. Thank you so much.
Be well, doctor.
Thanks, Scott.
Be well.